My name is George Smith, and I'm an intern at the UT Health and Medical Reading Center, and I'll be covering the studies and treatment of plantar fasciitis. Plantar fasciitis is when there's an inflammation of a thick band of tissues known as the fascia that connects the calcaneus to the toes. The condition causes pain in the mid part of the foot, mostly during your first few steps when you wake up. Fascia is a sheet of connective tissue beneath the skin that attaches, stabilizes, encloses, and separates the muscles and internal organs. It lets muscles move freely alongside other structures and reduce frictions between each other. There are two types of plantar fasciitis, acute and chronic. Acute is uncommon and is caused by an injury to the fascia unrelated to wearing down. Chronic is a more common type of plantar fasciitis and is due to inflammation, wearing and tearing of the plantar fascia over a long period of time. Causes remain unknown. However, active patients between the ages of 40 to 70 are more prone to have it, as those who are overweight or obese have pressure being applied to the plantar fascia ligaments. For symptoms, pain is described as dull, sharp, burning, or aching near the heel of the foot, usually worse during the mornings and can be flared up due to increased irritation and inflammation. Pain is not felt during active activity, but post-exercise when at rest. When diagnosing for plantar fasciitis with patients who complain of heel pain, a provider would ask any, if not all, of the questions. When is the pain worse? If the pain is worse during the morning, then this can indicate plantar fasciitis most of the time. What are your exercise habits? Exercise is seen in patients with plantar fasciitis and those who do not exercise. Have there been any recent changes? People who start new habits such as changing jobs, engaging in different activities, or newly mothers may develop it due to the changes in the burden on the feet. And lastly, is pain relieved at all when pointing the foot downwards? If pain grows fainter, then it's a sign of plantar fasciitis due to the plantar flexion of the foot. After successful diagnosis of plantar fasciitis, it is advised to seek treatments. There have been claims stating conservative treatments such as tension splints and therapeutic modalities, as well as surgical treatments, are viable methods for treatment. In July 1996, an article was published titled Plantar Fasciitis, a prospective randomized clinical trial of the tension night splint. The objective of the clinical trial was to evaluate the efficacy of a tension night splint as part of a treatment regime for management of plantar fasciitis. 33 patients in the age range of 20 to 74, with the average age being approximately 45, were entered into the study. Patients were randomly put into a control group and a tension night splint group. The control group received standard anti-inflammatory medication, visco heel soft put heel cushion, and a stretching program for the gastrocnemius and soleus muscles, while the tension night splint group received the same treatment with an additional custom-fitted posterior splint. Patients were reviewed every 4 weeks and discharged when able to resume daily activities. The outcome measures used were subjective assessments of pain, plantar fascia tenderness, and ankle range of motion. Results showed that 6 of 17 in the control group were cured after an average of 8.8 weeks, with the remaining 11 switching to the night splint group and cured within an average of 13 weeks. However, 100% of the patients in the original tension night splint group were cured within an average of 12.5 weeks. In conclusion, the tension night splint is an effective method to treat plantar fasciitis when used with a stretching program, visco heel soft put heel cushion, and anti-inflammatory medication. In November 2018, an article was published titled Additive Effect of Therapeutic Ultrasound in the Treatment of Plantar Fasciitis, a randomized controlled trial. The objective of the clinical trial was to evaluate the efficacy of therapeutic ultrasound as part of the treatment of plantar fasciitis. 54 patients in the age group of 24 to 80 entered into the study. Patients were randomly put into an active intervention group and a control group. The active intervention group received self-performed stretching of the plantar fascia and calf muscles, and as well as therapeutic ultrasound. The control group received the same stretching exercises and sham ultrasound. Both groups received 8 treatments twice a week. Patients' outcome were measured by a numeric pain rating scale, computerized adaptive test for the foot and ankle, and an algometric test. Results showed that both groups showed significant improvement, but no significant difference was found between the groups, concluding that the additive effect of therapeutic modality does not improve the efficacy of plantar fasciitis. In March 2014, an article was published titled "Surgery for Patients with Recalcitrant Plantar Fasciitis." The objective of the trial was to assess the following of surgical intervention for patients with plantar fasciitis. 79 patients were identified from operative diaries undergoing plantar fasciectomy surgery between 1993 and 2009. They were contacted to investigate long-term results using self-reported outcome measures. After being contacted and investigating long-term results using self-reported outcome measures, 68 responses were received, and patients had said there was an average reduction in pain by a visual analog scale of 79%, and 84% of the patients were happy with the results, with no deterioration in success seen over time. In conclusion, there was controversy over surgical treatment due to biomechanical arguments. The article had reported success for surgery over a long follow-up period. Plantar fasciitis can cause extreme discomfort in active individuals and delay any goals one may have. However, it is not difficult to treat and it is possible to resume daily activities afterwards. Articles have shown that physical therapy and tension 9 splints are viable methods, and although there is controversial for surgical methods, they have been shown to be a success in long term for treatment for plantar fasciitis.